When you're the cancer patient, there are times when you are tired. There are times when you are physically and mentally struggling, and you're not always going to be able to be your strongest advocator, even though you're trying your very best to be that.
So the underlying premise of patient navigation then is that patient navigators will get the patients into the healthcare system ever in terms of getting screening or faster. And how they do that, as Dr. Freeman said, address barriers. That is the cornerstone of how a navigator works. They address barriers.
So what are the principal barriers that we find? Financial barriers. People don't have insurance or can't pay for transportation. Communication barriers. Healthcare system barriers, a complex system to get through fear and distrust. These were the initial things that we tried to solve through patient navigation.
They give people a roadmap. They give them a vision of this is what happens next. Don't be so anxious. It's okay. We've done this before. It's bad enough to have cancer, but to have fear is worse.
So we're not acting then in navigation as specialists in a silo. We're trying to act across an entire continuum from a point of being in a community, entering a healthcare system, having barriers, and helping people through to an endpoint.